Urban capital, lifestyle, society, entertainment, news, politics, economics. Urban capital, London, Midlands, North. Okay, so hi Chris, and thank you for joining me. I'll get straight in.
Good to see you again.
Thank you, and you. I'll get straight in asking you to just tell people who you are and what you do for a living, please.
I'm a GP. Yeah, so been a GP for about 30 years. Grew up in London. Got a very mixed family. My dad's from Nigeria, my mum's from Ireland. I've kind of worked all around the country. Now I'm sort of back working as a GP in Southwark.
Thank you. And obviously, I already know that you do lots of other things in terms of, in the past, I've known you through different community events, and I know you're not shy at saying things like it is.
Somebody's got to do it.
Exactly. And well, I've always admired you for that. So, like I said, I'm really pleased that you was able to give me some time today. So I'm going to start with the thing that everyone's talking about, which is lockdown, COVID-19, and all the various issues that people are having to deal with around that. I think that the big topic at the moment, where there's lots of discussion, is around the new information about BAME communities being at higher risk, or there's a higher number of deaths. They're saying that there's twice as likely to die of COVID-19 if you're from a BAME community compared to people from white communities. Can you shed any light on the discussion and what's coming out at the moment with that?
I can, yeah. So, I mean, it's tragic and it's terrible, but it's also, in a sense, not really surprising. I mean, BMA communities, Black and Asian communities, tend to have higher death rates and higher illness rates from virtually every single medical condition except malignant melanomas. And that's for all sorts of reasons. So a lot of it is because of socioeconomic deprivation on the whole. So very often people are looking for sort of some simple explanation for something that's actually really, really complicated. So a lot of the stuff with, I mean, even the name of it, whether you call it COVID-19 or SARS-2, coronavirus, whatever, a lot of the scientific facts about it are kind of fairly complicated. But then it's also kind of mixed up with everybody's got their own different agenda. So the Americans and the Chinese and different people are propagating different versions of their truths and untruths and their fake news for their own agenda. So it's kind of very unclear, really, kind of like exactly what's going on. So with kind of Black and Asian communities, so very, very often, see, I'm not stereotyping, but as a generalization, we're more likely to be in lower paid jobs, more likely to be in sort of overcrowded housing situations, more likely to be on the kind of front line in healthcare and in the NHS. Maybe we're more likely to be sitting down having dinner with our children who are kind of super spreaders, they call it, and we'd be living maybe in multi-generational households where it's more likely for viruses to be spread from kids in their nursery and the playground through to working people, through to kind of older people. Maybe we're more likely to be hugging and kissing other members of the family, to be able to kind of spread viruses like that. There's all sorts of speculation about whether things like different levels of vitamin D might put different people at different risks. Some people have got theories that it's maybe kind of due to different kind of hormone levels. So basically there's no simple explanation for it. It's really tragic. I think the first 10 doctors in the NHS to have died from COVID were all kind of Black and Asian doctors. So a lot of them were actually senior consultants. So they're not particularly socially, economically deprived. They weren't maybe particularly elderly, in their maybe 50s and 60s. So the whole socioeconomic thing maybe doesn't apply to them so much.
Yeah.
So there's a lot of unknowns about what's going on.
Yeah. I was going to say there are some people that have concerns about, is it about quality of care? So, is there a correlation between the type or level of care that people from Black and Asian and, other minority ethnic communities might receive? So this is why I really wanted to talk to somebody like you, because that's quite a frightening thought. So, again, in terms of your experience of healthcare, what would you say to perhaps hopefully put people's mind at ease around that, or what people might look out for, or what would your views be on that?
On the type of care that minorities might be receiving.
Yeah.
That's nothing new. All of us who've been in the healthcare system as patients or visited, we've got kind of relatives who've been in the healthcare system, kind of know that something's not quite right. Sometimes it's difficult to put your finger on exactly what it is. But, we like people like ourselves. And when we're in the healthcare system, maybe sometimes we find that our Caucasian brothers and sisters don't relate to us in quite the same way. So that's kind of how it is. So that is, part of the whole complex picture. But in terms of why healthcare workers themselves who are not patients, why we should be getting double the rate of COVID is kind of unclear. So some of it is saying that maybe lower Black people in the NHS are having less access to PPE, like personal protective equipment. There's obviously this scandalous shortage of that equipment anyway. And when people are scrambling for what is available, I suppose there's a pecking order in who gets what. There's some people saying that maybe kind of Black people are being put forward to do some of the more risky face-to-face kind of healthcare. And again, maybe that wouldn't necessarily apply to some of the consultants who have died. Some of them would be in very sort of close patient contact, but some of them wouldn't be any more so than maybe sort of junior doctors or healthcare assistants. So again, so there certainly isn't just one factor that explains this.
And I wondered, actually, like you said, when it comes to healthcare workers, NHS staff, consultants, if that is naturally due to the numbers in the NHS, the numbers of staff and consultants that are from BAME backgrounds.
Yes. So yes, that explains it to a certain extent. They say sort of 44% of doctors in the NHS are from BMA backgrounds. So they half the country wants to get rid of us all. There really, really, really would be in a mess if 44% of NHS doctors left.
Yes.
But a lot of those doctors are, as I say, very, very senior doctors. Interestingly, most of them who have died haven't been British born. So there is a kind of a bit of a theory that maybe if people are coming from countries where sort of coughs and colds and flu are not so common, because coughs and colds are part of the coronavirus is not just one virus, but it's a whole group of viruses, including things like the common cold and influenza. So some people are saying, well, maybe if you haven't been exposed to colds and influenza very much, maybe as a child, then that would make you more at risk when you're sort of exposed to them in this country. So that's a possible theory.
And I suppose the and I don't have anywhere near anything called medical knowledge like that, but the immune system is, I understand, still a very complex thing to understand, isn't it? And I would imagine that argument is based on the immune system might be different if they've grown up somewhere else.
Yeah, very. I mean, in a sense, some people say, the kind of more we know, the less we understand.
Yeah.
So, we, as scientists, as doctors, we know all sorts of scientific facts and figures about things. But, so when I was at medical school, basically all they taught us about vitamin D was it's all to do with bone growth and bone metabolism. But people maybe with complementary alternative views on healthcare will see that vitamin D has all sorts of effects on the immune system and your general kind of welfare. Your mood, the sunshine, how happy you are, all sorts of things like that impact on your immune system. And as Western trained doctors, we're not really taught very much about that. There's this whole idea of epigenetics. So there's this sort of traditional idea that you've got your genetic makeup, but that genetic makeup can then be influenced by all sorts of factors, from generational trauma, from psychological factors, diet, all sorts of factors can affect us in ways that Western doctors just really don't really understand well.
Yeah. Well, it's correct, isn't it? Because your social surroundings have a big impact on your psychological state, and your psychological state has a big impact on your physical state. So there's a connection between all of those things, isn't there?
That's obvious to you, and it's obvious to me. But unfortunately, it's kind of not obvious to a lot of kind of Western trained doctors. Maybe they've got some idea of those kind of concepts, but it's not integral in Western medicine. So you go into hospital with some sort of physical complaint, you're laying in a bed, so you lose muscle mass, you're giving atrocious food, so you don't have all the good nutrition, you're treated just like an object, so you have no involvement in kind of what your treatment process is, feel isolated, depressed, lonely, people talk about you rather than to you or with you. And that sort of seems to be normal for Western medicine. Maybe things are getting a little bit better in some ways, but it's not getting that holistic care that we know that we kind of really need.
Because it's not to knock the expertise of Western medicine, is it? And certainly in the UK, we've got some of the best doctors in the world. But like you said, it's about that holistic approach, which it has a massive impact on everything and on recovery and everything else, doesn't it? In terms of people are more than one-dimensional, like you said.
No, definitely.
So I just want to touch more on, you talked about vitamin D, mainly because I had a scare story from my sister who was on the phone to a doctor earlier. The vitamin D in her body is practically nil. I have another sister that happened to recently, and neither of them were aware, like you said, of the impact of a low vitamin D count or how bad they could feel in terms of their mood and their physical well-being. So I'm trying to raise more awareness around that, and because it's quite a simple thing in terms of we need the UV rays from the sun. We live in a country here in England, certainly we don't, as Black people, get enough sun rays, and so we are really at risk, aren't we, of our vitamin D levels dropping, and it's something we should perhaps be educating ourselves about more, would you say?
Yeah, definitely. So particularly with children and kind of older people, they're kind of most at risk. So with children with a kind of bone development, they need lots of vitamin D, and kind of older people, particularly older women, more at kind of risk of maybe falling and breaking their hip, and they're having these serious consequences as a result of that. But for all age groups as well, Obviously, as you say, sort of as black people with dark skin, we get less of the ultraviolet light penetrating through the skin, and it's the sunlight that interacts with the skin to make vitamin D. So one of the strangest things is, even if you have vitamin D supplements, it doesn't have the same kind of beneficial effect as what you would expect. So your vitamin D levels in your blood could increase, but it's not necessarily going to have the beneficial effects with your immune system or with kind of other factors. So maybe the most natural way of getting it is through sunlight. So even in this country, we spend far too much time indoors. So even in this country, if you get out as much as possible and short of running around naked, just try to expose a bit more of our arms and legs, that is actually enough to get kind of reasonable levels of vitamin D over the spring and the summer. And so he's got traveling back to the Caribbean and Africa. If I could do that on prescription for people, I would do that more regularly.
You need to
I'm working on that with the health authority.
I was going to say.
You can get exercise on prescription. You can get arts on prescription. You can get.
I said that to my sister when she said, "I'm not sure how to manage that. As many holidays as possible."
And it's ironic. You could have one day in hospital that could cost the state maybe £400 or £500. You can get a return ticket to Ghana for that money. So the NHS it's got a funny idea about the most appropriate way of using resources. We take all the best doctors from West Africa and from Asia and give nothing back.
Madness.
Slavery all over again, really, in a different version.
And I'm not laughing because what you said is funny. It's because I know how direct you are, and it's absolutely.
Oh, sorry, is that too direct?
No, do not apologise.
No, I'm with you. I don't know. I'm from South London. We just say it as it is.
Sticking with what we talked about with the COVID and the BAME situation in terms of a higher number of deaths. Again, I was reading earlier that there's a feeling that if the data isn't put out soon enough or sooner rather than later, that it could actually potentially put more doctors, senior health workers, and other people from BAME communities at more risk. So they're saying that there's not enough data out there. And could you make any sense of that to me?
Because since I think the 1990s, it's been sort of compulsory for the NHS to do ethnic monitoring, but their argument for doing it is to show that services are being equally administered, which we all know is nonsense. So we know that there are inequalities. So we should do ethnic monitoring to demonstrate the inequality. So when they do ethnic monitoring, they don't really see the value of it. They have a lot of people have apprehensions about doing it. They don't really see the value of it. They've got so much else to do as well. So the easiest thing to do is just to click on the top button, which is probably black and white mixed or something, or or black whatever. So if you're maybe a young person who's come from Somalia, you've got a very different socioeconomic background to somebody who's come from Jamaica or the son of a Nigerian diplomat. So if you're going to do ethnic monitoring at all, actually it needs to be a bit more meaningful and a bit more specific to make any sense. So white people, they've got such a hang-up about the whole race issue that they don't even want to kind of bring up anything about ethnicity. So instead of saying to you, hi there, Marceline. Where are you from? Because you might take that in a sort of racist sort of way. But people won't do it in a way of interest. specifically kind of where are you from, because they're kind of interested or they actually kind of really want to know. Or so if are you British born Caribbean or in the Caribbean, or are you from Africa? It makes a difference to our maybe the physical conditions that we could be at risk to, and our whole kind of our psychological and sort of socioeconomic background. So they're talking about data, but it's like they're talking about rubbish in, rubbish out. So if you're not collecting meaningful ethnic data in the first place, how can you get a kind of meaningful result out of it?
Yeah.
And it just kind of none of it really kind of makes sense. So they know that something's going on. You know, they've got Simon Stevens, the head of the NHS, is kind of heading on this investigation. So they're going to come up with some sort of recommendations or conclusions, but they're not really going to address the fundamental problem, which is that there is issues of. I hesitate to use the word racism because it's some of it is. I don't think there's an awful lot of overt, deliberate racism. Quite honestly, I think a lot of it is just subconscious racism. I'm not excusing white people for that, but some of it is sort of subconscious. So the way that you or I will get judged, it's just almost like a subconscious reaction that some people have, and it's not going to address that kind of fundamental misconception that people have with when they look at you or me. So they'll come up with some sort of Mickey Mouse recommendations, but the truth of it is just going to be too contentious for them to kind of really deal with.
Yeah.
You know? So they're not, for example, going to be asking people like you or me to head this investigation because they won't like what we tell them.
Exactly.
So they're going to spend millions of pounds on this big investigation, and then they're going to be so embarrassed by what they do find, they'll suppress some of that, and then they'll present the kind of palatable version of what I have to say.
You've just hit on something there that I'm constantly talking about. It's partly why I do the media that I do, as you know, is that we are seen as this Black community, but actually the community, very diverse within itself, in terms of, like you said, differences of experience, you know, where our origins may be from and what that means in terms of our social experience. And I always say we have like a dual existence, really, in a way, because we can be in our homes. I grew up in a home that I always say it was like little Jamaica. But when I left, you know, I was always told I was British though. And then I left and I went to school. It was, you know, very white, or the area I lived in was very white. So you learn to kind of have that dual existence, don't you? You just slip between the two socially. But I think outside of our community, a lot of people don't realise that it's accepted and respected for, say, Eastern or South Asian communities. With the Black community, I don't think it is. I think even we don't realise how diverse we are.
Yeah, definitely. I mean, we can be many things. We can be Londoners, we can be British, we can be of Nigerian origin, we can be of Irish origin. Yeah. I can be a father, I can be the guy who walks his dog, I can be a doctor, and I'm all of those things. Yeah. I mean, I earlier on I kind of used the term race, and I kind of know that you haven't used it at all. And even the term race, you know, it's just an 18th century concept that's been dreamt up to give the idea that there are actually some people are sort of like a subspecies of human beings. Yep. So I don't have a problem with talking about different peoples, different nations, even different tribes, different ethnicities. But the term race kind of implies it's some sort of subspecies of human beings. And so even the term...
I was going to say, and as you said, that was what it was created to do, which is why.
Definitely.
Yeah, I like you. I use culture. I use those kind of words. Race. I will use it, but I try not to use it.
Put it in quotes.
I do.
So even the term racism, it reinforces this idea of race. So even the term racism, we should put that in quotes, really.
And I agree. The real word for racism, so somebody that really is projecting what we call racism, in my book, the word is ignorant.
Yeah, definitely. I mean, just going back to the beginning of all this coronavirus thing, there's, as I say, there's lots of lies and fake news and speculation and theories about it. But one of the things that I think is actually true is that there's a laboratory in Wuhan, the Wuhan Institute of Virology, and they were actually researching into bat coronaviruses. I think that's pretty factual.
Yeah.
And for some crazy reason, they decided it'd be a good idea to try and manipulate these viruses so that they can infect human beings. So some people are saying, well, they were doing that for sort of bio-warfare. Maybe they were arguing they were sort of trying to do it for medical research. But it seems a bit of a coincidence that in Wuhan Institute of Virology, they're doing that, and 100 yards down the road, they claim that there's an outbreak in the fish market. So I think whether it was deliberate or whether they sort of accidentally released the virus from there, that does sort of seem to be the origin of it.
I've said all along, it feels there does feel an element of Frankenstein about it, doesn't it? The whole thing.
And it's incredible the sort of things they can do with genetic manipulation now. So they can make artificial viruses, they can get viruses and they can manipulate the genes on them, all sorts of crazy Frankenstein stuff. So, as terrible as this all is, there's at the moment over nearly 25,000 deaths. It's, about 2 months ago, it looked like there could have been hundreds of thousands or even a million deaths in this country. So it is petering out a bit. It's not quite as bad as it could have been if the graph had gone up exponentially. So maybe it's actually time to kind of stop all this kind of crazy panicking and think, okay, it's not that much worse than, is it 5 or 6 years ago, kind of really bad flu epidemic when nearly 20,000 people died one winter just from ordinary flu.
Yeah.
So in this, I'm not going to throw lots of statistics at you, but in this country, every year, 600,000 people die every year. So a lot of the 20,000 people who've died now, a lot of them are people who sadly would have died of something else at some stage anyway, not trying to be dismissive of it. It's tragic that they died earlier.
Bringing it into perspective, though, isn't it?
Yeah, and all the publicity goes on people who are dying. But there's no publicity about, say, people like me who, and I'm sure I caught it about 8 weeks ago. Tragically, I went to visit someone. I'm sure I caught the COVID from them. Like 90% of people, I recovered from it. And I mean, sadly, this patient did die from it. But, most children will catch it and not show any symptoms. Most young people will get it and show very mild symptoms and then hopefully be immune. So the World Health Organization, at one stage, they were saying you're likely to be immune after you've caught it. Then last weekend, they were saying, oh, you're probably not. Now they're saying you might be, but we're not sure for how long.
Yeah, I mean, it's not...
a little bit unclear.
Yeah, I do have one of my interns, I say this probably every show because I referred to her. She returned back to Italy. And so I get a lot of up to the minute updates from Italy. And I've been told that people have caught it more than once. And as you said, survived. The reinfection thing it sounds a bit odd that they're saying, yes, they've seen cases of reinfection, but here it's still, we don't know, following the first reports in relation to China, suggested that over 80% actually caught the mild version. So where people are panicking that if they get it, it definitely means a fatality, that's not the case, is it? Because the majority of cases are actually the milder cases, aren't they, still?
No, definitely. Yeah.
And the last thing before I let you go that I wanted to try and get some advice from you on is because it's something I get a lot of phone calls and trying to support some people who are having a tough time with the lockdown and the kind of mental health impact. Is there any general advice you can give people in terms of what they can do at the moment or what they should do to kind of, if they need advice?
Yeah, I mean, like with a lot of things in health, it's just I suppose the simple things that are the most important. You know, like having some sort of regular routine, drinking lots of fluids, having a good kind of healthy diet. So all the things maybe you kind of wouldn't be doing because you're in a sort of unusual situation. And there's no particular reason to have a kind of regular routine and be cooking meals, but particularly at this time, it's important to kind of do that. Nobody's saying that people shouldn't go out at all. In fact, even the government is saying you should go out, and you should go out maybe up to an hour's exercise every day. So even if you think, well, you've got nowhere to go, just get out and kind of have a walk or do something. You know, it's easy enough to keep a good distance from people. So those kind of simple things you can do yourself. Just focus on the fact that we are actually over the worst of it. I mean, there are all sorts of online resources available for people who really kind of need a bit more help. I mean, there's a really good website called Mood Juice. The Mind website is really good. So yeah, Mood Juice and Mind are the two that I would recommend to people first of all.
That's brilliant. Thank you so much, Chris. Is there anything in general that you want to say that I might have missed that you think?
Yeah, I mean, about the wearing of face masks.
Thank you.
Yeah, so the value of face masks is to prevent you spreading COVID to other people. So it's not actually going to protect you from catching it from other people. So in some way, it's a good altruistic thing to do. And kind of washing your hands is the kind of way to protect yourself from picking it up from surfaces. You know, or the other way, I'd say to people, you should imagine that every surface is smeared with feces, and when you go out, you don't want to touch anything, which is actually because when people are wearing gloves, it gives them a kind of a false sense of security. So they're wearing surgical gloves, but then they start touching their face with the gloves.
Yeah.
Or, and it just, or then, dropping gloves. So the streets are full of disposed gloves now.
Yeah.
You should just go out and just don't touch anything. Your elbows, you can open the doors with elbows, you can shake hands with elbows.
I'm feeling normal now.
Keep your hands off of things.
Yeah. I feel a bit more normal now because that's how I've been behaving. I do stay away from people. I'm a little bit paranoid at the moment. But like you said, just washing my hands. I'm a little bit, people say OCD. I don't think it is OCD personally, with surfaces anyway and wiping down lights and things. So I just think that's a good way to be because you're always passing bacteria around your house anyway. So you should clean like that anyway, at least once a week.
Yeah, definitely. Yeah.
But thank you for clearing that one up with the face mask, because I know even at the moment on social media, there's a lot of discussion and confusion. I think that's the main thing, is that people just feel confused often with the information that's coming out on a day-to-day on mainstream, and sometimes then have a hard time trusting what they're hearing. So, I trust you and I trust everything because you're just so direct. I know you. But thank you so much. I'll let you get back to your very important job, and I hope that you are don't have to see too much grimness. I know people like you get to see it all firsthand. So thank you for what you do. And, thank you for being such a great GP and a supporter in the community as well.
All right. Thank you, Marceline. So we'll do this again time.
Definitely.
Take care.
All right. Take care. Bye.
Bye.
It was